Alzheimer's disease is the most common form of dementia, with symptoms that develop slowly and gradually worsen over time, becoming severe enough to interfere with daily tasks. Dementia is a term that is used to define conditions caused by brain injuries or diseases that negatively affect memory, thinking, and behavior. Alzheimer's disease is known by many to be a condition that causes memory loss. It is most common among seniors, with most patients being diagnosed after the age of 65. However, Alzheimer's is not a normal part of aging. Many individuals under the age of 65 can be diagnosed with early onset Alzheimer's, which can be due to genetic predisposition. The changes brought about by Alzheimer's disease can greatly disrupt the lifestyle of affected individuals. Let's follow Dominic's story to see how this disease has impacted his life. Dominic just recently turned 65 and is starting to notice that he has difficulty remembering new information. Dominic often asks repetitive questions and initiates similar conversations, along with forgetting where he left his personal belongings. This is something that his wife Linda also picks up on, as this is quite a behavioral and personality change for Dominic. Concerned for his well-being, Linda takes Dominic to a doctor for an evaluation. Since there is no single test for Alzheimer's disease, the doctor looks at Dominic's signs and symptoms, takes a medical history, and rules out other conditions before making a diagnosis. A patient suspected of Alzheimer's disease is checked for neurological function by testing balance, senses, and reflexes. Brain scans such as CT or an MRI may make up additional assessments. After ruling out other possible conditions, doctors will carry out cognitive and memory tests to assess the patient's ability to think and remember. During his assessment, Dominic has difficulty answering some personal and general knowledge questions. Gradual memory loss and progressive neurological impairment are key symptoms of Alzheimer's disease and can impact a patient's daily life. Alzheimer's is a neurodegenerative disease, meaning that the neurons in the patient's brain are breaking down and dying. Unlike other neurological disorders, which affect a specific part of the brain, Alzheimer's causes the breakdown of the entire brain. The exact cause of Alzheimer's is still unknown. However, it is partly due to abnormal structures called plaques and tangles, which damage and kill neurons, specifically in the hippocampus. The hippocampus is needed for retrieval of memories, specifically short-term. So a person with earlier stages of Alzheimer's is able to recall childhood memories, but not what they did earlier that day. As Alzheimer's worsens, long-term memory is increasingly damaged. The cortex overall becomes thinner, slowly shrinking the brain. As plaques and tangles build up and spread, the frontal lobes are also impacted, where a person with Alzheimer's may struggle with decision-making, planning, organizing, and complex tasks. There are several risk factors for developing Alzheimer's disease. Unavoidable risk factors include age, as individuals over 65 are more likely to develop the condition. Statistically, having a familial history of Alzheimer's puts individuals at a greater risk, as genetic inheritance of certain genes like apolipoprotein E is linked to the condition. Recent studies have reported that modifiable factors like diabetes, hypertension, obesity, smoking, depression, physical inactivity, and low educational attainment are all linked to the prevalence of Alzheimer's around the world. While there is no significantly effective medication, there are lifestyle choices that patients can make to slow down the progression of Alzheimer's. Healthcare professionals suggest that getting regular exercise, learning and participating in cognitive training like puzzle solving, along with a healthy diet, can reduce the severity of Alzheimer's. Additionally, managing the risk of cardiovascular disease, diabetes, obesity, smoking, and high blood pressure are also beneficial. Research suggests that a multi-domain intervention that regulates diet, exercise, cognitive training, and cardiovascular risk monitoring is effective in preventing cognitive decline in at-risk elderly people aged 60 to 77. Data suggests that individuals who received this intervention performed better on cognitive assessments. Multi-domain interventions exhibit a protective effect relative to cognitive decline, a hallmark of Alzheimer's disease. Interestingly, it has been shown that adherence to a Mediterranean or MED diet results in improved cognition or minimized cognitive decline, specifically in the memory and attention criteria. The key components of a MED diet are based on plant foods, while maintaining low consumption in dairy and red meats. This diet is largely void of sugar, cholesterol, and trans fat, the aspects of a common diet that are considered to be associated with poor cognitive functioning in older age. The positive outcomes of a MED diet to cognitive health suggest that it can impact brain health, and in doing so may protect against Alzheimer's progression. Alzheimer's is a devastating disease, which still has many unknowns associated with it. Although it is a condition that progressively worsens over time, making proper lifestyle choices can help delay symptoms and improve quality of life. If you think you or a loved one may have Alzheimer's, your first step is to talk to your doctor. They can help make a diagnosis, discuss what you can expect, and connect you with the services and support that you may need.